Understanding speech errors is an important part of a speech-language pathologist assessment. In this video, you'll learn some key information that will help you work together with your SLP to choose the right sounds or patterns for therapy. This is an important message about the following content. Please pause and take some time to review. Let's start off with some definitions. Articulation is how we move our lips, tongue, and other parts of our body to produce sounds. A phonological process is a pattern that generally applies to a group of sounds. Most children use phonological processes at some point during speech development. This is why some children say lello instead of yellow, or wed instead of red. Speech sound development describes the pattern of acquiring or learning sounds. Speech sound development happens gradually, usually from birth to 7 years old. SLPs tend to use developmental norms to assess, identify delays, and plan for therapy. Developmental norms are standards for when the average child demonstrates a particular skill. Let's take a look at developmental norms for speech sounds. This chart gives us a rough idea of when different American English speech sounds are developed or learned. Let's read this chart together for a 4-year-old. To do this, we will follow the vertical line for the 4-year-old age. Based on developmental norms, we would expect a 4-year-old to accurately say sounds where the blue bar is completely on the left of their age line, which is the first 12 sounds. We would expect them to be learning sounds where the blue bar covers their age line. We would not expect a 4-year-old to say a sound if the blue bar is completely on the right of the age line. Say the sound accurately, that is. When children are learning and trying to say words with sounds that they have not yet learned, they naturally simplify those words. We call this a phonological process. We expect children to use phonological processes at some point during speech development to simplify the words that they are trying to say. We already know lello is an example of a phonological process. Let's talk about another example. Sounds made at the back of the mouth, like k, the K sound, can be tricky for some children to say. A child may simplify this by using the front of their mouth instead, like t or the T sound. This is why it's common to hear a child say tat instead of cat. There are developmental norms for phonological processes, which outline when the average child no longer uses that phonological process. Your speech-language pathologist is trained to assess if a phonological process is expected for your child or not. Developmental norms describe the average child, but we know children are unique. There are many unique things that may impact sounds or phonological processes. Some children seem to be able to produce the more difficult sounds before the ones we expect to be easier. For example, a child named Zara may say the Z sound earlier than another child of the same age because that sound is in their name. Children are also unique in the structure of their articulators or function of their muscles. Things like a tongue tie, cleft palate, missing teeth, overbite, and dysarthrias are all unique characteristics. Hearing may also be unique to the individual. Recurrent ear infections or a permanent hearing loss may impact how sounds are heard, learned, and articulated. Family and medical histories are also unique. Sometimes, a family history of a speech delay or disorder can impact the child's speech development. Unique things about a child and developmental order are two factors to consider when choosing sounds to work on in speech therapy. Let's talk about 6 more. How complex the movement is to make the sound. For example, the T sound, t, means the tip of our tongue moves up and down. This is a less complex movement pattern than shh, where we have to use the tongue and the lips. How easily the sound can be seen. For example, with the M sound, we can see the lips go together. The K sound, k, is harder to see because it happens in the back of the mouth. How easily the sound can be imitated or said with a bit of help. SLPs sometimes call this stimulability, and it's an important part of a speech assessment. How frequently the sound occurs. For example, the S sound, s, is a more frequently occurring sound in English compared to the V sound, v. Finally, two of the biggest considerations are meaning and need. Working on speech errors is intended to have a functional outcome for the speaker and facilitate participation in their meaningful activities. Working on speech errors may not always be needed. There is a huge range of neurodevelopmental diversity in speech, which is a fancy way of saying people speak differently, and that's okay. Sometimes saying sounds differently is not something that needs to be worked on in therapy. The speaker and the important people in their life should decide if there's a need or not. You now understand a bit more about speech errors, including developmental norms and things to consider. This will help you work together with your SLP. Thanks for watching.